The top 5 infectious diseases that I'm going to discuss are in no particular order. Ehrlichiosis, anaplasmosis, number 1. Number 2, West Nile virus. Number 3, enterovirus. Number 4, food poisoning. And number 5, Lyme disease. But ehrlichiosis slash anaplasmosis, which is the sort of sister disease, they are spread by tick. Often the same tick that spreads Lyme disease and a lot of these other bad. It's a pretty nasty little bug, or this Ixodes tick, and the infection is injected by the tick. You don't catch it from someone else. You catch it from a tick bite. Most people who get infected with ehrlichiosis and anaplasmosis don't get particularly sick. A lot of them don't get sick at all. Otherwise, you can get a mild flu-like illness, headache, muscle aches, chills, nausea, vomiting, cough, perhaps. The people who are otherwise healthy don't generally get very sick, and they will get over it whether they're treated or not. If they're treated, they get better faster, but they'll get over it even if they're not treated. Occasionally, you can see a rash, and then older people or people who have immune problems will possibly get neurologic disease with coma, seizures, and those people can get very ill, and occasionally it can be fatal in those people. So we really don't want to miss it in someone like that. Some people can have persistent fevers that can last for weeks or months with this. So it can be serious business. Most people don't get very sick with it, but there can be an occasional person that can be sick. Fortunately, there is treatment. So treatment is doxycycline, which is a really rather common antibiotic, readily available. And the nice thing about it is it is usually given orally. You don't have to take it intravenously, so you can even go home and take it as long as you're not so sick that you have to be in the hospital.